Today we're going to talk about the 12 cranial nerves. For the cranial nerves, we have the olfactory nerves, we have optic nerves, we have oculomotor nerves, we have trochlear nerves, we have trigeminal nerves, we have abducting nerves, facial nerves, and vestibulocochlear nerves. We have the glossopharyngeal nerves. We have the vagus nerves. We have the accessory nerves, and then we do have the hypoglossal nerves. Each of them have their function, and let's start with the olfactory nerves. Let's begin with the nerves. The first one is the CN1 olfactory nerves. Olfactory nerves has four functions: sensory and smell. We can find it in the nose. How to test the olfactory? As I have a patient, we're gonna see how I test my patient to identify the difference between a coffee and the peppermint. Okay, and we have a patient right here who's blowing his hair. I'm gonna start with this one. Would you mind to tell me what is that?
It's a coffee.
Coffee. Thank you. And then we have this.
Peppermint.
Peppermint. Thank you. Our second cranial nerves is the optic nerve CN2. The CN2 has for function the sensory and vision. How to test that? We're gonna use my patient.
The itsy bitsy spider.
We have this one. What is that?
I. T.
Okay.
S. Y.
Three oculomotor nerves. His function is a motor, most eyes movement, pupil contraction, eyelid elevation. How to test? I'm gonna ask my patient to follow my finger to test the extraocular movement. We have a fourth cranial nerve is the trochlear nerves. The trochlear nerves have a function to for motor move eyes down and in. I'm gonna use how to test it. I'm gonna use my patient to follow my finger downward and inward. What if for any double vision or difficulty with this movement? I'm going to do down and inward. Oh. The fifth cranial nerves is the trigeminal nerves, CNV. The CNV trigeminal nerves has for function both facial sensation and chewing. How to test that? We have the sensory. The sensory is like you ask the patient to touch a forehead, cheek, or jaw. And then we have the motor. We have to ask the patient to clean their teeth. Well, you palpate the mastoid and then the temporalis muscle. The sixth cranial nerves is the abducting nerve. The abducting nerves has for function motor movement eye laterally. And how to test that? You can ask the patient to follow your finger has side to side. Has the example. So we have the seven cranial nerves is the facial nerves CNV 2. What has for function both facial expression test. It's the anterior tongue, tears, and saliva. How to test? Ask the patient to raise eyebrow, close their eyes tightly, smile, puff out their cheek. But so my patient didn't want to do that. So this is where you can find like how exactly it works for the facial nerves. We have the eighth cranial nerve is the vestibulocochlear nerves. It's a nerve CNV 8. It has for function even in balance. Like even it's you rub your finger near each ear, and then We have for the balance, we perform the workbench test, like you ask the patient to stand up and then put their feet together and then close their eyes and then see if they're straight. We have for the next cranial nerves is the glossopharyngeal nerves. The glossopharyngeal nerves have for function to test swallowing and gag reflex. How to test this one? You have to touch your posterior pharynx with your tongue, the pressure, and then you can ask the patient to swallow and listen for any difficulty. The vagus nerves, it has for function for parasympathetic control, swallowing, and voice. And how to test this one, you can ask your patient to say hi, observe if they are uvula rise middle, and then also listen for hoarseness in their voice. The 11th cranial nerves is the accessory nerves. The accessory nerve has for function shoulder ridge, head tones. How to test that? You can ask your patient to hug both shoulder against resistance, then ask them to turn their head to each side against your hands. The 12th or the last cranial nerve is the hypoglossal nerves. The hypoglossal nerves have to function tongue movement. The tongue movement, how to test it? You're gonna ask the patient to stick out the tongue. It should be in the middle. If it deviated to one side, it may indicate a lesions. Okay. To finish, those are the 12 cranial nerves, each with a unique function and help identify every clinical test for a patient. Thank you.